This has been a great year at Children's Hospital of Michigan. We have had thousands and thousands of amazing stories, but today we want to feature 3 very special families and children. Baby Brooke was born at 23 weeks and was transferred immediately to Children's Hospital of Michigan, weighing only 14 ounces. And not only did she need the expertise of our neonatologists, she also needed the expertise of many of our pediatric subspecialists like ophthalmology and neurosurgery. And that's the kind of care you can only get at a children's hospital. We have our subspecialists on hand 24/7 to make sure that these kids have the best possible outcome. Flavou was born at just over a pound, and he was not a candidate for open heart surgery because he was so fragile. And luckily, with the help of Dr. Tom Forbes, he placed a stent in his heart and helped him heal, and today he's a happy and healthy 1.5-year-old little boy. Baby Lachlan was transported to Children's Hospital of Michigan after only being 2 hours old. He had a very rare condition where his bladder was outside of his body. And thankfully, Dr. Lakshmanan, our chief of urology, had seen this type of condition before. And the only kind of condition that really can be treated at a specialized children's hospital. So we were thankful that baby Lachlan was here in the right amount of time, and now he is living to be a very, very happy 1-year-old little boy.
Hi, baby.
Whether they're your first or your 5th, babies are always full of surprises. But 1-year-old Lachlan started throwing his first-timer and newlywed parents for loops even before he was born.
We weren't going to find out if we were having a boy or girl. And then we made the mistake of taking the envelope home from the OB office, and it lasted total of
8 hours.
8 hours before we decided to open it, which actually told us that we were having a baby girl. And then at 34 weeks,
It was like literally 5 days after the baby shower full of pink tutus that, I think you had the regular scan.
and I was just joking around with the person that was doing it. I go, can you just make sure that she's still a girl? Because I just had this gut feeling that I was having a boy. She's like, wait, we told you were having a girl? Because you're definitely having a boy.
It was like a whirlwind ever since I got that call and kind of rushed out there to see her and beside ourselves type of thing with the news.
That whirlwind would only intensify. Lachlan's mother labored with him for 42 hours at a Troy hospital before Lachlan made his debut on Halloween. That's when a new surprise turned joy to anxiety and fear.
I really wanted to do a vaginal birth so I could hold my baby. And he was just whisked away from us right away. And the first time I got to see him was through a picture.
All of a sudden, 7 or 8 nurses coming out of nowhere, it was like panic stations, and just didn't know what was going on. I saw a snapshot of Lachlan when he came out, and I could see something on the outside of his body. I'm like, that doesn't really look normal.
Lachlan was born with bladder exstrophy, his bladder inside out and exposed on the outside of his body. Treating the rare birth defect, a 1 in 50,000 occurrence, required an immediate transfer to Children's Hospital of Michigan via the Panda 1 intensive care transport team.
And I remember after he was born, I was like, how do I tell anyone what's going on? And I just remember just texting my best friend going, I just need you to pray because I don't know what's going on right now. And it's not good. And Lachlan's not here. He's going to Children's.
The chief of pediatric urology, Dr. Lakshmanan, actually served a lot of time at Johns Hopkins in Baltimore, so it kind of put our mind at ease that, hey, not only is it the most convenient, location-wise, but we're going and getting the best standard of care possible.
Before he was even 1 day old, Lachlan would undergo a complex urological surgery.
And I don't think it really crossed my mind, or I didn't really realize that much that this is the most I'm gonna hold him for in a month. I can't hold him for a month after this night. I just stayed up that entire night and just held him and looked at him and took videos of him and just literally could not stop crying because I was so scared for the next day.
It was a high-risk procedure, and the success rates depend on a lot of things coming together really correctly. We performed the first stage right away, practically when he was a day old. and we put his bladder back together in. So the first procedure has to be successful for the rest of his life to be successful. And we were able to achieve that.
Recovery from that initial surgery required Lachlan to be in traction for the first month of his life, relying on the teamwork of his parents and the hospital's dedicated care teams to get him ready to come home.
I think it was around the second week of his stay that we found our nurse, and we asked her to be our primary. And I literally think about her all the time to this day. Because I don't know how I could have gotten through it without her. And I felt like she really cared for Lachlan, and she was so encouraging because I couldn't breastfeed him, like, because he was in traction, and she was so encouraging about pumping, and this is what's going to be so good for him. He's in the hospital, like, he really needs this from you.
We tried to make everything as easy as possible, so we actually were able to get them a big bed. This way we tried to have mom be able to be as close to him as possible, because when you're in a crib, you can't always be right next to the baby when they have their legs up in that position. I always try to put myself in their shoes, and being a mom myself, my heart broke for her because I just tried to imagine what she had just been through, their whole family.
When I held him for the first time, I just wanted to sing him a song that my grandma used to always sing to me. You are my sunshine, my only sunshine. All of a sudden, this song just had such a deeper meaning because it says, please don't take my sunshine away. And I guess there were so many days in the hospital that I was just scared we weren't gonna go home. When she was on, we felt so safe, and we felt like we were gonna have a good day.
With 2 surgeries down and a third to come a few years down the road, Angela and Matt feel like the scary surprises are behind them and their Halloween baby.
The fact that he's kind of developing on pace with everything, like, he's the smiliest, happiest baby I think you could ever meet. Like, look at him, and like anyone that knows him, you would never know what trauma he's been through in the first month of his life.
We're definitely thankful to all of his doctors and his nurses, and we felt like they took care of him like he was their own.
We have good orthopedic colleagues, we have good anesthesia colleagues who are able to do the specialized procedures. We have a great hospital OR team and the NICU, and it all came together for us.
Dr. Lakshmanan cared so deeply, we felt like, for Lachlan, and literally came up to the NICU and checked on him every day. He gave us his personal cell phone number and checked in on us while we were still there, and that really meant a lot to us.
The most difficult time in our life was made that much easier by staying down at the Children's Hospital in Detroit. And again, if we got to make a choice ever again, I would make the same decision 100 times out of 100. That was really, we felt like we got the level of attention and care that we really needed at that difficult time for our family. It gave us hope that there is actually life after this and something that we have to look forward to.
At 23 weeks, the pregnancy wasn't viable. I mean, if she would deliver then, the chances were very, very small.
We cherish family most during the quiet moments, the noisy kitchens, and remembering battles won. At the Detroit Medical Center, we're thankful for being part of your story.
We're here because we want to make a difference.
It comes back to love and working together, and we're a team.
And my ability to deliver that result extends from my love for them.
These are my people, and I want to make sure they live the healthiest life possible.
We will be here to help you get back to the special moments in life. We're a community built on care.
There's only one thing kids take seriously: being a kid. They don't worry about getting sick or hurt. They're just here for a good time. But we take kids very seriously. At Children's Hospital of Michigan, we only have one focus and one purpose: the health of your child. Because there's a big difference in a hospital that also cares for kids and a hospital that only cares for kids. That's why we've devoted our lives to caring for your child, just like you. The new Children's Hospital of Michigan.
As firefighters, we run towards the danger. Sometimes we get hurt, but that's just part of our job. So when I got severely burned, there was no question where they were going to take me, and it was the DMC, Detroit Receiving. Detroit Receiving gave me a second chance at life. They have a level 1 trauma center, in one of the few verified burn centers in our country. DMC, Detroit Receiving, just treat you like family. I've seen their miracles and I believe in DMC.
Finding out you're pregnant with twins is life-altering. Going into labor 8 weeks early, terrifying. The team at DMC Hutzel Women's Hospital cared for me and my babies for 27 days. Their NICU became home and they became family. I believe in this place so much, I changed careers. Now I'm a NICU nurse at Hutzel. I come to work every day, not feeling like I'm coming to do a job, but here to make a difference, just like the Hutzel NICU made a difference in my life. Michigan's first women's hospital is a community built on care.
Little Flavu, or Avi as he's best known, is everything you expect a 2-year-old to be.
He's very cute. He's a happy little boy.
Restless.
He's very friendly. He likes kids. I think he would rather go and play with a kid rather than just play with a toy.
He's very curious about things. He's at that age that he's, discovering new toys, discovering new, things that are not toys. They're not supposed to be toys. He's a normal little boy.
The fact that his parents are able to say that now is nothing short of miraculous. After 23 weeks of what had seemed like a perfect pregnancy, Dan and Raluca began a struggle for the life of their young family.
After an ultrasound, the doctors told me that the fetus was small for gestational age, so he sent me to a high-risk doctor. We were doing maybe 2 ultrasounds a week and see how the fetus is growing.
The whole ultrasound took like an hour or an hour and a half because they would measure, every arm, head circumference, everything. The blood flow from the placenta to the fetus and everything else.
Doctors discovered that Raluca had intrauterine growth restriction. Her unborn Avi was being deprived of adequate oxygen and nutrition through the placenta, stalling his development.
We waited until 26 weeks, and when they said, okay, we need to get you to the hospital. At 23 weeks, the pregnancy wasn't viable. I mean, if she would deliver then, the chances were very, very small.
Making matters worse, Raluca developed a severe form of preeclampsia, putting hers and Avi's lives in danger.
They monitored the baby and my wife's vital signs around the clock.
I started to vomit and my blood pressure increased very high. So that's when the doctor came in and he said that I have preeclampsia with HELLP syndrome and the only treatment would be C-section delivery.
That C-section brought Avi into the world at 27 weeks, a full 3 months early.
As soon as he was out, the NICU doctors took over him. They got him in an incubator. They said it was a good thing that they were able to get him out without a sac around him being, broken, which was good because he was very fragile. At birth, he weighed 470 grams, almost a pound. His skin was translucent and, he looked like a doll.
Yeah.
He was very, very small, like this size. The doctors, they actually warned us that this would be, the first day would be kind of like the honeymoon phase because he would be doing well. But after that, it would, get tougher and tougher.
It did, almost immediately for Avi. Already connected to machines to help him breathe, he developed pulmonary hypertension. He was transferred to Children's Hospital of Michigan, which specializes in the nitric oxide treatment he needed.
So what basically the doctors told us is that he needed level 4 NICU care, which the hospital that he was born at, they didn't have that over there. So that's why they decided the best course for him would be to transfer him to children's hospitals.
There was not a moment when they show that he's not gonna make it. They reassured us every time that he will be better.
His list of challenges included patent ductus arteriosus, or PDA, a heart problem which causes abnormal blood flow between 2 major arteries.
When you're in the womb, your lungs are shunted So you get the fresh oxygen through the blood through the mother. And once you're born, that shunt will close and will give a chance to the baby's lungs to start and take over. And in many cases, when the babies are premature, that PDA, that shunt, it's not closing, and then they need to do surgery for that to close.
So the typical procedure that we normally do is an open chest procedure where they go in from the left chest area and they would collapse the left lung in order to put clamps on the ductus. And in infants where they're very sick, as far as being on the highest ventilator settings, they really don't tolerate having their left lung collapsed in order to do that procedure. So another procedure to do, which is a newer procedure, just got approved, which we were one of the institutions that started this procedure, was that we go in from the leg instead and go on up to the heart and actually put a device in there that actually would close the vessel itself. And therefore we didn't have to do any left chest incision, nor did we have to collapse the left lung. We just did it while his heart was still beating and his lungs were still inflated with the ventilator.
When they say that it's never been done on a baby with his size, it got us worried. But at the same time, we didn't want an open surgery on him because we knew that he was not doing very well and he was still on the ventilator.
They needed him to be off nitrous oxide before they did this procedure. And the nitrous oxide was the very thing that was helping him deal with the high pulmonary tension. This non-invasive, it was very new, and I think he was the very first one because he was very small. He was the very first one for his weight at that point.
He didn't get any more treatment with nitric acid after the surgery, and basically it saved his life.
Avi spent 5.5 months in the neonatal intensive care unit, undergoing surgeries on his eyes and to correct hernias, all the while leaving a lasting impression on everyone he touched.
Avi was well known in the NICU section, and a lot of nurses knew him. He's, I think, the only one that had 4 or 5 primary nurses.
Primary nurses.
That's like whenever.
It's our second family.
Right about the time that he got released from the hospital, he was able to breathe on his own. So he came home without any oxygen support. We like Children's Hospital, DMC, so we recommend that hospital to other parents. And if other parents are going through this right now, don't lose hope. There's light at the end of the tunnel. Be strong, pray, and hang in there.
She was so tiny, and it was just day by day. It wasn't, they couldn't say, what the outcome was going to be because nobody knew.
Football is a big deal in this house. So when Maurice was injured, we immediately thought the worst. To see my baby lose his joy hurt.
The DMC, Rehabilitation Institute of Michigan, is here to help athletes get back in the game.
They're like family. It was a long road, but we made it back.
DMC, Rehabilitation Institute of Michigan, a community built on care.
There's only one thing kids take seriously: being a kid. They don't worry about getting sick or hurt. They're just here for a good time. But we take kids very seriously. At Children's Hospital of Michigan, we only have one focus and one purpose: the health of your child. Because there's a big difference in a hospital that also cares for kids and a hospital that only cares for kids. That's why we've devoted our lives to caring for your child, just like you. The new Children's Hospital of Michigan.
We cherish family most during the quiet moments, the noisy kitchens, and remembering battles won. At the Detroit Medical Center, we're thankful for being part of your story.
We're here because we want to make a difference.
It comes back to love and working together, and we're a team.
And my ability to deliver that result extends from my love for them.
These are my people, and I want to make sure they live the healthiest life possible.
We will be here to help you get back to the special moments in life. We're a community built on care.
Finding out you're pregnant with twins is life-altering. Going into labor 8 weeks early, terrifying. The team at DMC Hutzel Women's Hospital cared for me and my babies for 27 days. Their NICU became home and they became family. I believe in this place so much, I changed careers. Now I'm a NICU nurse at Hutzel. I come to work every day, not feeling like I'm coming to do a job, but here to make a difference, just like the Hutzel NICU made a difference in my life. Michigan's first women's hospital is a community built on care.
On September 12th, 2017, baby Brooke entered the world at just 23 weeks gestation, weighing 14 ounces.
When she was born, we were told she was given a 2% chance of survival.
She was probably the length of my hand. I couldn't, touch her or hold her or anything.
And her skin was transparent. So everything was very crucial on her. So we couldn't touch her for at least a couple weeks.
Well, when I met baby Brooke, she was already about 6 weeks old. When she was born at 23 weeks, she was very small. She was on the brink of being a survivable little baby. By the time she was 6 weeks, she was being monitored for a small intraparenchymal hemorrhage and intraventricular hemorrhage. And this is something that happens to babies when they're born premature or at such a very young age.
She was so tiny, and it was just day by day. It wasn't, they couldn't say, what the outcome was going to be because nobody knew.
Because she had a hemorrhage in the ventricle spaces, that can be life-threatening. In addition, the way that the ventricles increase in size, slowly but steadily, that can increase the pressure in the brain and not only threaten her life, but also leave her to have a lot of developmental delays and issues down the line in terms of her function.
We were just terrified. We didn't know what to expect.
The first part of the surgery is to put in a small catheter that goes in through the brain and connects to a little reservoir. And we place this in the very little babies where they're not ready to have a permanent system placed. By placing this, it's called a intraventricular reservoir. The neonatology doctors can then access the reservoir, and they access it once every day or so and remove fluid that has a lot of the blood products in it in order to help relieve the pressure that baby Brooke was dealing with every day.
But Brooke would endure several more procedures, including laser eye surgery, surgery to treat excess fluid in the brain, and treatment for PDA, a heart problem common among premature infants.
You would take a step forward and 3 steps back.
In addition to having all of the issue with her heart and her brain, she also had an issue with her guts, where she had something called necrotizing enterocolitis, and that resulted in the fluid that was being shunted to her abdomen to not absorb anymore.
The doctors and nursing staff here were just absolutely outstanding.
They were phenomenal. They were really phenomenal. They handled her so gently. They were very encouraging. It was days that I was just in tears.
This baby would not have made it as far as she has and be so incredible if it wasn't for the incredible team work that multiple specialties at Children's Hospital of Michigan were able to contribute to. While many of her issues were neurosurgical, the commitment and the team-based approach from the neonatology physicians and their team, as well as the cardiac doctors, is just incredibly important.
It was a true blessing to be somewhere where she can get all the care that she needed at one place.
Her outcome is incredible. She has been a mind-blowing little baby.
And definitely has a big personality, very loving and compassionate for others. She's so welcoming. I always want to give a hug and say hi to whoever,
She is quite possibly one of the cutest little babies I've ever taken care of, and it's really been a pleasure to see what kind of a fighter and incredible spirit she really is, and she's doing incredibly well.
We're thankful for Children's Hospital and their medical team for giving us hope, giving us our daughter in good health. Everybody from the nurses, the doctors, the specialists, they all coordinate with each other, and I thought that was a big thing.
And they keep you informed, very well informed. If you have questions, if one of the nurses doesn't have the answer, they get the answer. They just don't leave you, out in the cold. That's a great support network that they have here. Unfortunately, the other hospital that she was at, they didn't have the equipment, necessary for her survival. So, Children's saved her life.
There's only one thing kids take seriously: being a kid. They don't worry about getting sick or hurt. They're just here for a good time. But we take kids very seriously. At Children's Hospital of Michigan, we only have one focus and one purpose: the health of your child. Because there's a big difference in a hospital that also cares for kids and a hospital that only cares for kids. That's why we've devoted our lives to caring for your child, just like you. The new Children's Hospital of Michigan.
We cherish family most during the quiet moments, the noisy kitchens, and remembering battles won. At the Detroit Medical Center, we're thankful for being part of your story.
We're here because we want to make a difference.
It comes back to love and working together, and we're a team.
And my ability to deliver that result extends from my love for them.
These are my people, and I want to make sure they live the healthiest life possible.
We will be here to help you get back to the special moments in life. We're a community built on care.
Over this last year, I am extremely thankful for the physicians who have dedicated their lives and their careers to the children in this community. I'm extremely thankful for the nurses who have a caring touch and compassion every single day, and I'm thankful for the staff at Children's Hospital of Michigan who really make moments matter with our families and really help get them through the most difficult times in their lives and in their children's lives. So for that, I am extremely thankful every day, but especially today.
I was thankful because I was trained in a place where we did a lot of this. So I was able to take care of the child here rather than having him go elsewhere. And it was very helpful for the family to have somebody local. And I happened to be working in an institution which was able to provide the services. So it's just, as I said before, it's not a one-person show. So we have good orthopedic colleagues, we have good anesthesia colleagues, we have a great hospital OR team, and the NICU. And it all came together for us. So that's what I'm thankful for.
Well, I'm very blessed, first of all, to be able to work here where they allow me the opportunity to be part of clinical trials. We were one of 5 institutions initially performing this procedure on infants this small.
One thing I talk about with the various families that come through, whether they're transplant patients or more complex heart surgeries that we do, or even some that are more straightforward, is the support of the families around here. Every patient upstairs is sick after the surgery, and the other parents that have been through it are there to support them. And I think that's really special and unique about what we have here in good old Detroit.